Joining us via Skype is a consultant neuropsychiatrist and founder, Pinnacle Medical Services, Dr. KADIRI. Good morning, Dr. Maimuna. Thank you for joining us on TVC Breakfast.
Good morning.
Now, we know Nigerians as very resilient people in the face of daunting challenges. They are up and about, smiling. But you see, this time it seems so different. The kind of reaction we are getting, not even just in Nigeria, even across the world, especially when it comes to their mental health. Talk to us about how much impact this pandemic is having on the mental health or mental state of a lot of people.
So we have this model we use, which we call the biopsychosocial model. And you can have that triggers to causes of what leads to mental illness, and that model can be used with regards to how to manage it. So this is a global pandemic. Nigerians are not alone. You and I, it's a global issue, but it's causing a lot of challenges. We do understand that even before the pandemic, there are some people that are already vulnerable. And because of this, they as much as possible, the pandemic can be as a trigger in this regard. So people that are already vulnerable, for example, somebody that already has a history of mental illness is a vulnerable person, or somebody already dealing with mental illness is a vulnerable person. So for the pandemic at this point in time, it can trigger anything in anyone, even if you're not even vulnerable at all. The fear, the panic, the anxiety, sometimes even sadness. Reason being that nobody knows the end. Nobody knows when this will come to an end. And then we have a lot of fake news all around the whole place that it's even heightening the anxiety. It's making people more fearful. And this is not an illness for just the elderly or for people in their middle age. It covers everyone, including the children. And with the closure of institutions, some parents are going to have it easy, having their children with them. So the impact is huge. But my major concern right now is that we are not looking at that cycle, part of the psychosocial model. We are not looking at it. It's a big problem because the aftermath of this pandemic, some people may begin to have what we call the post-traumatic stress disorder. And some people may even be depressed and suicidal. So it's very pertinent now that the government should look into the psychological well-being. Even if we're having food bank, we're having the relief packages and all that, we should put a system in place where the psychological well-being of Nigerians to be put into, be made known and taken care of.
Now, you are the expert here, and over time you have had people, since this pandemic began, you have had people reach out to you. What has been the major concern for them? Why are they panicking at this point?
So one thing we noticed from our own institution or our own facility, there are three top things on that run. Fear of the unknown, changes in eating and sleeping pattern, then anxiety. But we found some people are already depressed, even suicidal. So it's not a matter of let's wait till after the pandemic and we can now help to manage the situation. Some people are already suicidal right now. And if care is not taken, we are going to have people die just because, and they're not confirmed cases of COVID-19, but for the fact that they are depressed and they are suicidal. So, and these changes in the sleeping and eating pattern is huge. Let's not forget there's partial, in quotes, lockdown. Even if in Lagos, Ogun State, and Abuja, the president has said they should lock down, people are in houses, they are not in homes. And these houses are more like they are in a toxic environment, they are in a hostile environment, toxic relationship. So it's not everybody that we say stay safe and stay at home that are in safe places. So these are the things we really need to look into.
But if at this point, how can the government come in? Do we have the structures in place if we say we want to do telemedicine and the likes?
The thing is that we have what we call Association of Psychiatrists of Nigeria, National Association of the Psychologists of Nigeria. These are bodies. So the government can't do it alone. This is the time to reach out to organizations like that, including the private people involved, and work with them. So there's a presidential committee on all these issues we are dealing with. These people should be incorporated. With the way things work now, look at the way we are discussing. I didn't have to travel all the way. Put a system in place where these people can also work remotely, helping those, like helplines that are toll-free. So we have toll-free lines for the NCDC for people to call in if they're having symptoms. Why can't the government also deploy toll-free lines, and this association of experts come together and run a shift? So if you want to discuss or decluster your mind, if you are going through any challenge, this is the time to do it. Let's not wait till this whole pandemic is over, and then we now have a huge increase in the number of people dealing with mental illnesses, from post-traumatic stress disorder to depression, and even those that have even killed themselves. We can do it now. We have a group. They can leverage on such platforms to help deliver the service. It's not an individual thing. My organization can only do just 0.000%. But if you leverage on the network of these people, knowing fully where they're in their homes, they don't need to go anywhere, and they can take calls and help people that are dealing with these challenges. For me, to be a more holistic approach with regards to what we are already having on ground.
All right, Dr. Maimuna, we'll leave it at this point. Thank you so much for speaking with us. Joining us via Skype is a consultant neuropsychiatrist and founder, Pinnacle Medical Services, Dr. Maimuna KADIRI. Good morning, Dr. Maimuna. Thank you for joining us on TVC Breakfast.
Good morning.
Right now, I want for you to talk to us about solutions. How can people ensure that their mental health state does not deteriorate at this point?
The thing is that it involves each and everyone. So before we can say government should do something, you as an individual, you also have to look at your own well-being, knowing your stressors, knowing if you are already vulnerable, knowing having a support group who can help you in case you need help, ability to have a good, healthy circle around you. So the truth is that we are all in it together. So this is not something that is just affecting an individual. It's a global pandemic declared by the World Health Organization, but it is multifaceted, multidisciplinary, and multi-sectorial approach in helping us to feel safe, feel connected, feel supported, and of course feel appreciated as Nigerians. If we have to look at having toll-free lines for NCDC to call for you to have U-screen if you have symptoms, and information all over the net, food banks, state government even trying to put this in place. Let me just give you a hint of what this impact can really be. So we are the essential services, the media, the frontline people. But the truth is that even our own workers, ability for them to come to work now with this 2 weeks lockdown, how do they feel supported if they don't have the right transportation system that can bring them to work? It's going to be very difficult. So now they are going to look for maybe private vehicles. Most of these businesses are SMEs. We are not talking about those, even the government facilities, the private ones. So in helping to ensure the mental well-being of Nigerians, what we should all look at is how can we really feel safe at this point in time? If I don't have it and my relative doesn't have it, how are we going to ensure that mentally we are in that right space? So please, keeping in touch with people that you have in your circle is very key. Verifiable information from well-known sites is also very good for our mental well-being. As much as possible, managing your stress and anxiety by knowing what are your stressors. So if you are having a lockdown starting from today, if you have not been sleeping so well, maybe this is a good time for you to listen to your body and rest, and be calm, be still.
One other aspect is the aspect of nutrition. Some have said that perhaps feeding could play another major role to helping people, stay calm at this point. Talk to us from that point of view.
The thing is that there's this Maslow hierarchy of needs. So if you want to look at this 5-tier hierarchy of needs, the first tier is food, shelter, and water, with other things that come into that place. If there's a lockdown, truthfully, yes, the essential services are open. Markets are not open. People, you are not going there to go and get food for free. Yes, the food banks are there, but how many people will it really cover? That is what we should look into. And then, of course, we know that when you eat healthily, one of the preventive ways that we can fight for COVID-19 is to eat healthy, drink good water, and of course, have good rest and exercise. If you don't even eat well, you cannot boost your immunity to fight this virus. It's a virus infection. Boosting our immunity also, one very important role to that is good nutrition, eating the right meal. It's not to go and soak gari in the morning, eat eba in the afternoon, and then eat another kind of carbohydrate in the night. If you don't have the right meal with the right nutrients, truly, if for any reason anybody is faced with this or is confirmed a case, the immunity is not enough to boost, to help fight this virus infection. So please, nutrition is also very key. And it's also good for our mental status. We should not also look at it that let us just eat and just be well. It helps in both physical and mental wellness. So from that angle of nutrition, we need it in all ramifications to keep good and keep calm and stay safe while staying at home.
All right, Dr. Maimuna, thank you so much for speaking with us.